New variants and subvariants also are proving more easy to transmit person to person. This does mean that prior interventions like indoor masking may not have the same community level impact as they did before. Not because masks don't work, they do work, but because we would have to use them, high quality masks, much more consistently, always, every time we're around each other, because the virus will exploit any opportunity to transmit much more easily. We also know that SARS-CoV-2 it can be present in animals, and that means that it could be reintroduced time and again to humans. We are going to be living with this virus for the foreseeable future. We are not going to be able to eliminate it for the We'll continue to have to live with these peaks and valleys in our COVID case rates. I am concerned about long COVID as well. The impacts after infection that can last for weeks to months. The challenge with long COVID is that it is something we still need to learn more about. It is not clearly defined nor measurable. So it is difficult to know how we would put interventions towards ending long COVID because we don't know how we're doing on a population level. It is critical. When we cannot fully control the virus, we have to consider a harm reduction approach. Public health ethics, including via the American Public Health Association and other expert groups, acknowledges that there is no absolute right or wrong answer in most situations in public health. There are always trade-off issues. And if we look just at the example of masking, the least invasive way that public health masking, or that we can influence masking or think about masking as a public health intervention, is education. So explaining how they are highly effective at preventing infections, and we have done that at a minimum. The furthest on the continuum is a general mask mandate, a legal requirement that people are masked in indoor public spaces. This limits choice. It is most acceptable when not taking such an action would result in significant harm to public health, and there are no alternatives that could achieve the same goal but are less authoritarian. The health orders are powerful, and they are extraordinary. We must always strive to define what our realistic goal would be with the changing understanding of the science of COVID-19, and what we can do as a least restrictive measure that could achieve that goal.
To hear the comment that wearing masks is authoritarian is theater of the absurd.
I am very disheartened to hear Dr. Phillips' comments about mask mandates being authoritarian.
I'm disturbed by your likening of mask mandates as authoritarian. If it's so authoritarian, why do you have mask mandates at your meetings? It's
Your department is still requiring masking in your meeting. Even I see people social distancing, and it's certainly not the case on public transit, where many high-risk people ride to get to essential appointments, to get to work. Many of our members at Senior and Disability Action don't have cars and depend on public transit.
When you've got seniors at home in their 70s with other health conditions like I do, it's not okay.
And Muni has failed to institute a mask requirement and said they will only do it if the Department of Public Health does it. And in this case, the strong recommendation is just not cutting it. We need an indoor mask requirement.
So they're in a situation where they need you to step up to the plate and lead. FMTA's Citizen Advisory Committee and Supervisor Dean Preston have asked you to act.
San Francisco is now in a high transmission state, which you guys said would be when we would revisit mask mandates. Yet it's not happening. Why aren't we doing everything that we can to stop the transmission of COVID? It's not just about hospitals.
Also, being hospitalized is incredibly traumatizing. Being on a ventilator is it's a horrible experience. The fact that there's room in the hospital, it should really be no reason to send people into that.
5 to 30% of COVID survivors will get long COVID. The CDC itself put out a report that 20% of people 18 to 64 and 25 of those 65 plus will develop at least one health condition after COVID infection. We are in the midst of a mass disabling event. Even young, healthy, and boosted people are getting long COVID.
Callers have mentioned 1 in 5 COVID infections becomes long COVID. It's not something that can only last for months. As Dr. Phillips says, it can last for years, and we don't know that there is a cure or treatment ever.
And I worry and that without strong public health leadership, people are going to learn the hard way what I've already been through pre-pandemic. They're going to do things that they think are low risk. They're going to get a chronic debilitating illness, and they'll think that they did everything right when they didn't, because our leaders are failing us.
We get our messaging straight. We're not out of it. 20% of these infections are going to lead to long COVID. We need to start dealing with that. We need to start understanding how it impacts our teacher shortages, our driver shortages.
But we need this mask mandate to protect everyone on transit, to make sure it remains a welcoming environment.
It is not public health to normalize mass infection and disability. It is not public health to not mandate masks in indoor public settings.
Right now, the policies make my life expendable. And to say that it's authoritarian and too much to ask people to wear masks.
You know, it's not authoritarian, it's caring. And I don't know how I can teach you to care about other people.
Calling and asking you to show the courage that your colleagues across the bay showed in Alameda County by reinstating the mask mandates. Mask requirements benefit us all.
When you mandate wearing a mask, you are saying protect your neighbor from...
Please reinstate mask requirements. You are all just one COVID infection away from being expendable like me.
At the beginning of the pandemic, the Bay Area, we like to tout ourselves and say, we're the leaders. So lead. Don't act like masks are this big oppressive tool. They're protections, they're not restrictions. So please, for the love of God, reinstate the mask mandates, because two-way masking, that is one of the biggest tools to protect all of us, not just the most vulnerable among us, but all of us.
We don't need thoughts and prayers on either. We need policies in action. Mask mandate, please.
I have underlying health issues which make the risk of contracting COVID and long COVID terrifying. I have a medically fragile husband with limited mobility and 2 one-year-old grandchildren who are too young for vaccines. I must keep them safe. Our country and the world as a whole are facing dire threats from all directions. I hope San Francisco and the Health Commission can return once again as a beacon of hope for all of us. Thank you.